welcome to our discussion of mental health services in Door County. This event includes a live transcript. If you'd like to turn your captions on or off, they're under the CC or closed caption symbol at the bottom of the toolbar. Please remain muted through the program and so the speakers can be heard. If you have a question, ask the question in the chat and we'll try to answer them at the end of the program. The discussion is being recorded, so let friends and family know that it's available on Facebook and it will be available also on YouTube in a few days. And without further ado, here's Susie Kohut from the League of Women Voters.
Good afternoon. My name is Susan Kohut, and I'm a member of the leadership team of the Door County League of Women Voters. Thank you for joining us today. And thank you especially to Laura Kayakan and the Sturgeon Bay Library for partnering with us to provide this important program. The League of Women Voters of Door County began in 1953. We are one of 20 chapters in Wisconsin and one of hundreds across the country aligned with the National League, which, by the way, celebrated its 100th birthday in 2020. The League never supports or opposes any political party or candidate. We are therefore nonpartisan, but we are also a political organization of women and men dedicated to encouraging and promoting good government through informed, active participation in all levels of our democracy, local, state, national. We in the Door County League work to empower voters through activities such as candidate forums and voter registration, but we also study and act on political, social, and environmental issues that impact our communities. The League continuously works to eliminate any and all barriers to full participation in our organization and to prevent or eliminate any such barriers in our elected governing bodies and in the voting process and political elections. At core, our fundamental and urgent message is democracy is not a spectator sport, so we urge you to get in the game. Today's program is an outcome of the Door County League's 3-year study of mental health substance use issues in the county. We hope that it will help our citizens learn about the range of mental health services available in Door County. Staff from the County Department of Health and Human Services have generously agreed to present this program. So I would like to present Joe Krebsbach, Health and Human Services Director, who will facilitate the program.
Thanks, Susie, and hello, everybody. I am, as Susie said, the Director of Health and Human Services, and I have 3 of our managers to kind of just talk a little bit about what the continuum of care is or the types of levels of service that we offer in the community. This conversation started many months ago as the League and I met and talked about kind of options, and I was pretty excited to be able to offer to folks kind of the array of services that are available, not just necessarily from our department, but from the rest of the community. I also see Lauren Doust from the hospital here, and if she's going to stick around for a while, I may ask her if she wants to jump in and tell us anything about their programming. So we're going to talk a little bit about kind of the types of services that we have, kind of from the lightest touch to the heaviest touch in terms of how we do services. And we had talked a little bit about trying to cover all of the services available in the county. And we decided we're going to skip that today in terms of outside agencies or independent providers, because we're not sure exactly who's out there and what's available. That's kind of been a changing dynamic. And so we'll talk about the types of services, but not necessarily all the agencies. And I will say that I'm a little less excited about sharing all of our information at the moment, just because things have changed drastically since the conversation that I had with Susie and a couple of the other board members. And so Door County Department of Health and Human Services and in the division that Donna oversees. Donna Altepeter is our behavioral health manager, and I'll have her talk in just a second. But we have lost 3 staff since that conversation, and we're down to only 3 providers out of 6 in our team of in-house staff and contracted staff. And so we're reeling a little bit. And at the same time, we know that Counseling Associates, another private entity in the community, is also planning to close shortly. And so I would say we're maybe not in quite as good a spot as I thought we were 6 months ago in terms of services that are available. With that, I don't want to be, Debbie Downer or too negative. So let's talk a little bit about what services we do have available. And we'll go through our managers in the department who provide or work with specific types of services and kind of let you know what that continuum of care is. And so I will pass it over at this point to Donna Altepeter, and I will also say if folks have questions, feel free to write them in the comments, or that's probably the best way to do it. And then if we have those, we'll get to those at the end of a short presentation. So Donna, you want to talk a little bit about our outpatient services?
Sure. So I'm Donna Altepeter. I've been here about 4 years as manager of behavioral health here at Door County Health and Human Services. I'll say a few things about our services, and then additionally, what else is in the community. As Joe said, it's a little more limited than it was, but there are still some good basic mental health services available. As the county provider, we offer mental health outpatient services, so that's individual therapy, as well as AODA outpatient services. And those services are both individual and group. We offer a intensive outpatient group and then a combined group of relapse prevention and primary treatment. Those groups are by referral only. So if someone is getting AODA services here, they may be eligible for the group services too. Then I should add that all of the services that we do provide, they come through our crisis case manager. So when a client is looking for services, or we have somebody coming out of the hospital, everything pretty much filters through our crisis case manager, Brianna Franken. And she takes information and then gets it to the team, and we assign it for therapists. There are a couple other providers in the community that also provide mental health services. Door County Medical Center does have a team of mental health providers. I believe there are also AODA providers on that team, although they don't provide group services. And then Bellin has a mental health provider here in Sturgeon Bay as well. So there are 3 ongoing resources for mental health. There are some private providers, but as Joe said, a lot of them are in transition and changing. So I'm not in a position to report about who's taking clients at this point. But those 3, Bellin, Door County Medical Center, and the Door County are all currently serving mental health clients outpatient. I should add that we also place clients, we assist clients in placement for residential treatment for AODA, so for alcohol or drug treatment. That happens when a client's needs exceed the ability for us to meet them as an outpatient. So we can help assist with that placement by working with contracted providers in the region. I would say there's not any here in Door County. And our placements range from here to Plymouth to Rhinelander to Manitowoc. We've made placements even in Chippewa Falls. So it's pretty broad placement, but we do assist clients for residential treatment as well. And then I'll just add, if Lauren can talk a little bit, if there's time to talk about specifically Senior Life Solutions as an additional service to Door County Medical Center's behavioral health, that would be great. And that's all I have.
Did I miss it, Donna? Did you talk about our psychiatrist?
I didn't, but I will.
Great.
Yeah, it's okay. So we also do have psychiatry services. Dr. Ann Miller is our full-time psychiatrist. She prescribes. Her along with our nurse, Scott Davis, prescribe medications for client psychotropic needs. So that referral generally right now, she takes referrals from primary care physicians. So if a client is seeing somebody for primary care, but the primary care physician thinks that the client needs something a little bit more than them, they can make a referral to Dr. Miller, but it is by referral only at this point for new patients. But she's here full time, and it's been great to have psychiatrist. She is the only psychiatrist right now in the county. So she carries a pretty big load in terms of servicing our clients for DOOR.
Thanks, Donna. So as I mentioned, there's kind of a transition in terms of level of service and those in need. And next I would ask or introduce you to Jamie Cole. Jamie is our Comprehensive Community Services Manager, and she'll tell you a little bit about that program, when it got started, and what types of clients we serve there.
Thanks, Joe. Hi, everyone. I'm Jamie Cole. I've been with the county for about 7 years and about 4 years in my current position, managing Comprehensive Community Services. Comprehensive Community Services is a Medicaid-funded rehabilitative program that serves individuals across the lifespan who have mental health or substance use concerns. So it's a recovery-oriented program. It was implemented in 2014, so it's relatively new. Eligibility is determined through a state functional screen and a needs assessment. So we provide wraparound support services that are often community-based. Examples of the services that we can provide are psychotherapy, wellness management, skills development, psychoeducation, substance use treatment, medication management, and so on and so forth. We have quite a lot to offer. Services can be provided anywhere, so school, home, community, outdoors. We also have another program that is for youth who do not meet CCS eligibility criteria called CST. So that is our coordinated services teams. That's our grant funded initiative, and criteria to enroll in that program are youth with an identified severe emotional disturbance, and they need to be involved in 2 or more systems of care. So over the past few years, we've integrated those programs. Examples of Cst Supports and Services are a little bit more outside the box. We can provide equine assisted services and items and like sensory aids, therapy tools for processing disorders, autism, anxiety. We can offer respite, incentives, and transportation assistance. So the philosophy of the work that we do is the same for all of our wraparound programming. It's person-centered, it's strengths-based, and it's consumer-driven. We tend to start out with a lot of services in place, but the ultimate goal is to really build those natural supports and community engagement. We also can offer some alternative treatments within those 2 programs. So for example, we have 4 equine guided skills development providers. We have an art therapist. We have someone to do sound therapy, speech and language services, and nature-based services. And I think I covered everything. I don't know, Joe, if there's anything you'd like to add to that.
Well, I wouldn't necessarily ask you to add to it, but I'm curious and I can't remember the timing. But one of the things that we did in Door County is we really developed this program. Was it 6 or 7 years ago, Jamie? Do you know?
2014.
Okay. So in 2014, we added this program and kind of built it slowly, and it has taken off to be quite a large program for us. But it really was to try and fill the gap between individuals who did well in Donna's area that could function well with just therapy from a mental health perspective. And Cheryl's going to talk about a more intensive program in a second, but we had a gap in there in terms of folks that needed intensive, very much on a weekly basis or more in the home kind of therapies that we were doing versus the outpatient folks who just intended a once a week counseling session. And so CCS was really built to fill that gap. And the beauty of the program is that the funding also allowed us to bring in and develop outside contractors in the area to try and enhance what we had available in Door County. And again, I think we did that well. So, all right, Jamie, thanks. Anything else you want to add before I pass it off?
No,
Okay. Then I'd like to introduce Cheryl Flores. And I will, actually, I just am blanking on Cheryl's actual title, so I'll let her tell you that herself, because she used to be our community support program manager, and now she wears a couple other hats on top of that. So sorry about that.
It's a
Cheryl.
crown. It's the queen. No, I'm Cheryl Flores. Thank you for the invitation. I am the community support manager. And I supervise the community support program, our targeted case manager, and crisis services, which also includes 2 adult protective service workers. So I'm going to start with the community support program because it piggybacks off of Jamie's program. So the community support program consists of 3 full-time CSP workers, and then we contract with certified peer specialist, Seth Wiederhanden, who is joining us today, and Magda and Karen Sullivan. We contract her through specialized services to do some in-home work with individuals in the community support program. We take referrals strictly from Dr. Miller as our clinical director. She makes the determination that the individual has a chronic persistent mental illness and that without intensive case management services, the individual is at risk of reoccurrent hospitalization. We also take referrals from Jamie's area when there are individuals that are struggling. They may have kind of reached a plateau with their recovery goal, and they just need more long-term ongoing case management. We have transitioned people from CCS to CSP. So basically the service that we provide, it is Medicaid funded. The caseloads are limited. 1 staff to 20 clients is the ratio. But everyone that is referred, they do have a individualized treatment plan. The case manager, we are supposed to do 60% of our work in the community. So it's breaking from that pattern of individuals coming in to see the doctor, individuals coming in to see their therapist. We are doing more work with individuals in their homes to develop independent living skills so that they're more successful trying to maintain a part-time job or just maintaining an apartment that can prevent them from an eviction situation. Case managers work very closely with Dr. Miller. We staff with her every Monday morning along with the nurse. And what we are discussing is symptom management, medication management. Scott has approximately 17 of our clients on long-acting injections. We have a contract with Stru's Pharmacy, and they deliver blister packs for 35 of our patients that some of them come in and pick up their medications weekly. For others, we do medication drops in the community. And what we're doing is we're assuring that individuals are compliant with their medication. We're checking for side effects, and then we're constantly reporting back to Dr. Miller. If they are starting to have breakthrough symptoms, we're able to get them in with the doctor sooner. And the goal is to have that medication adjustment, provide some more intensive services. Some of our clients are seen 2 or 3 times a week. It's whatever it takes to keep that person stable in the community. And then it's nice post-COVID, Jack's Place is starting to kind of reopen for services. So we really try to get individuals to Jack's Place to socialize, but also to participate in some of the programming, such as Seth does Tai Chi. There's an art group. There was an anxiety depression group, music, drumming, as well as journaling. So it's nice that we're starting to get individuals back in face-to-face group activities at Jack's Place, which is open to the public, and it is identified as a mental health resource center. So that's kind of what CSP does. And we currently have 57 individuals in that program. A lesser service, and this is where an individual may fall if they can't qualify for CSP, they don't qualify for CCS. We have one worker, her name is Ashley Bungle, who does targeted case management. And her position is, it was developed to be part of the APS, or Adult Protective Services unit. And she gets her referrals primarily from Dr. Miller. Dr. Miller sees a lot of clients for medication checks only, and there's not a therapist involved. And she had identified that some of these individuals were struggling. They were missing their appointments. They needed reminders. They really needed someone to pick them up and assure that they got in for their psychiatric appointments, or they were new to the system and they needed extra assistance in applying for benefits or getting to the ADRC to apply for family care. They just weren't able to navigate the complexity of some of the paperwork requirements. So this position, targeted case management, is a MA billable service. We do provide case management to individuals on Medicare, even though we do not get reimbursement, just because the individual needs the service. And without the service, again, we're concerned that it may lead to an unnecessary hospitalization. So what Ashley is able to do when she gets the referral, she does an in-depth assessment. We develop a care plan, identifying the goals, and then targeted case management is really meant to provide assistance in connecting with services. So we're helping people apply for energy assistance, housing, legal aid. We're connecting them with Social Security Administration, ADRC to do the family care referral. We also sit in on psychiatric appointments and medical appointments with the client's permission. And that is for the purpose of being able to help the individual with the medication compliance and help them to follow their treatment recommendations. Targeted case management is not necessarily long-term. I would say about half of the caseload, it's really, we're going to work with them for 6 or 7 months. And once they are stable on their meds and we've gotten them connected with all of their services, if they're able to do it independently, we're going to close that case and open up that space for our next referral. So that's our targeted case management. So then I'm going to talk a little bit about crisis services. So the county has a mandated crisis program under the Wisconsin Administrative Rule DHS 34. This requires the county to provide 24/7 crisis services to the citizens of Door County. We have to provide 24/7 phone service, which we contract through Family Services. That means that every time someone calls the crisis line, it is going to Family Services in Green Bay. They are scheduling 3 staff 2 shifts and then 2 staff overnight. And their job is to triage every phone call. They do a lot of information and referral. They do de-escalation, and they will also assist with referrals to outpatient programs for counseling. Frequently, Brianna will get referrals from Family Services each Monday, and they're able to try and develop, their goal is to try and develop a safety plan with the individual that calls. If they're not able to develop a safety plan through Family Services, then the next step is Family Services will contact our crisis on call worker. Currently, Joe mentioned that we had 3 therapists that recently resigned. Those therapists were part of our crisis team, and they were part of the crisis rotation. So we're going to be down to 6 workers and 2 contract workers. And one of those workers is still in training, and that's Ashley Bungle. She's only been with us here for a month, so she still has to get her 40 hours of crisis training. And we have Brianna, who we rely on as our crisis case manager, Monday through Friday during the day, doing all of our crisis call. Is going to be a new mom, and she'll be on leave coming the end of June. So we're going to have a very small crisis team. So part of crisis services is also to mobile out. And the 2 places we mobile out to, we go to the emergency room and we will mobile out to the jail. Some of our staff reside in Green Bay, so mobiling out in the middle of the night is an hour's drive up here, doing an assessment and then driving back home. So while we're trying to staff up and fill our vacancies, we will be doing some virtual crisis work if that is if that works for the police and it works for the ER. There will still be situations that the staff are going to need to mobile out just in order to do the full assessment. We also have to provide walk-in crisis services. So Brianna, that's part of her primary role. So Monday through Friday, 8 to 4:30, if an individual walks into the clinic and they want to speak to a crisis worker, they do not have to have an appointment. Brianna will meet with them. If she's tied up on another crisis call, we look to see who else on our team is available so that individual's needs can be addressed. So those are the primary crisis service. And then the other mandated service we have is adult protective services. And we have 2 full-time adult protective service workers. That's Kim Kramer, who's been doing it for 2 decades, and Ashley Thornton, who is fairly new into the APS position, so she's still training. But adult protective services is very similar to crisis. The difference is we are dealing with individuals that are identified as being incapacitated due to a medical condition or an accident, and they no longer are decisional, and they need to have someone appointed as a guardian, or a doctor has declared someone incompetent and they're not likely to regain competence. Typically, that would be Alzheimer's dementia, which is an organic diagnosis, and there's not a cure. So once a medical doctor has made this determination, we immediately start working with family. We hope that families will be proactive and do advance directives and get that power of attorney for healthcare and finance paperwork ready, so that if this situation happens, that 2 doctors in the emergency room could activate it. And if that happens, APS does not have to step in and make those decisions. The POA is able to make the decisions. But in situations, we have a lot of elderly in Door County. They don't have family supports here. They may be a widow. They end up in the emergency room. The doctor determines that they are not able to return home safely. At that point, any of our crisis workers can initiate an emergency protective placement that detains the individual at the hospital. And then Adult Protective Services and the discharge planning social workers at the hospital immediately start looking for a nursing home placement. And then all of the legal proceedings follow that's necessary to appoint a legal permanent guardian and a protective placement. So that kind of covers the array of crisis services for individuals with mental health, developmental disabilities, substance abuse crises, as well as our aging population in Door County, where we're seeing more and more cases of dementia. Thank you.
All right, thanks, Cheryl. We've got a few questions that came in. I'm going to not handle those quite yet. I want to address a couple of other program areas that are not specifically, they don't fit into the realm of the services we're talking about, but they are services in our community that connect people to this. So we have 2 diversion programs. We have an adult diversion program for individuals who have a drug addiction or a drug use concern. They maybe are not addicted, but have developed or had some contact with law enforcement. And so the goal in the diversion program is to offer services to people before they get into the court systems. And so that is a relatively new program for us. It's been running for a couple of years, really slowed down quite a bit when COVID hit, and is gaining momentum again. We also have a youth diversion program, again, for kids who have contact with law enforcement. But then we are doing some assessments on those kids and determining whether or not they have AODA or mental health needs and making referrals for those kids. That program has really taken off. We've anticipated about 35 referrals in the first year, and we received over 80 referrals in our youth diversion program. So again, that's an opportunity for kids to get some service, maybe some education. They might get referred for things like vaping or getting into a fight at school, or maybe inappropriate texting, those kind of things. And so we're trying to intervene on them so they don't end up in the legal system, but rather we can provide some education or some counseling as needed. And then we also have a drug treatment court program, and our drug treatment program has been going now for about 2 years. And again, this is another program that really connects people with both AODA services through Donna's division and comprehensive community services through Jamie's division, but it is a alternative to incarceration in hopes that we can help people make some better changes in their lives. And so those are some other initiatives that we've kicked off in the last few years to try and enhance and offer a wider array of what we do. Okay, I'm going to go through some of the questions. I will not probably take them in order. Let's see here. So one of the questions was, how do people get started in services? And if they're trying to figure out which program area they fit in terms of the one we presented. And I'll take a stab at that, and then I'll maybe toss it to Donna. But one of the things I'll say is that individuals don't necessarily jump into one of those higher level programs right off the bat. They actually come in and they are referred through our regular behavioral health channel in Donna's area. And I'll let Donna jump in if you have more you want to say about how people get started with services.
So it sounds a little complicated, but the best thing I would say to do is to call the main number for Human Services. And Brianna, our intake case manager, can triage. She can figure out what somebody is asking for and where they need to go. But for therapists, for mental health services, she would be the person they would call and ask to get a therapist. As I stated earlier, you cannot call and just and ask to see the doctor. That requires a referral from a primary care physician. But the therapist you can. Someone asked specifically about a wait list. We do have a wait list right now because we're trying to fill those positions. I can't say how long people would have to wait. There's no way of knowing. It's whenever there's space. for our current therapist to take somebody new. But what Brianna is asking people to do is to check with other providers, but we'll keep them on the list. And if something opens up, we'll be in touch with them. So we are keeping a wait list and keeping in touch with people as openings occur. We do make referrals to Jamie's unit for CCS. And Jamie's unit makes referrals for their clients to us. So it kind of, it goes back and forth. She has clients that, or there might be clients that come through that want to CCS services as well as the mental health services, and it happens at the same time. We're seeing a client and we think that it's appropriate that they see CCS, so or get CCS services, so we could make that referral. For Cheryl's CSP services, that is not something that clients can refer or that we can refer to. That is really, that's a program that really requires a referral from Dr. Miller. So that doesn't come through Brianna. That's a situation where actually Cheryl, I can identify who those people are in a variety of ways. They kind of surface in our community, and that referral is made from Dr. Miller to this community support program. So I would say probably the safest thing to say about referrals for services is they really do come through our front desk and go to Brianna Franken, and she can kind of determine where people need to go. One thing I did want to add, I don't know if anyone's asked about it, but I forgot to add, was that we see clients with a wide variety of ability to pay. Some people come in with insurance, some people come in with Medicaid, some people have nothing, and we can service all of those people. We do ask people who don't have any kind of insurance, if they need assistance with payment for services, we have a sliding fee scale based on their ability to pay. So we do ask for some information so that we can establish a plan for them. But we can service any clients regardless of their insurance status.
Thanks, Donna. Just so folks know, again, there's kind of the front door is the door, and we'll get folks to where they need to be, as Donna said. And one of our staff she's trained to help with that piece. Our number to call is 920-746-7155. Whew, I almost gave the old one. So that's one of the other things that I was thinking is our goal today really wasn't to just highlight only county services, but as I said earlier, I'm a little concerned about trying to talk about what we're doing and what's happening with all the other private entities at the moment. But Lauren, I see you're still on there. I'm wondering if you'd like to just tell a little bit about the services that are available at the hospital, and in particular, the Senior Life Solutions, as long as we've got you here, because I think that's a new program people would like to hear about. Nothing like putting you on the spot out of the blue, huh?
Thank you, Joe. I wanted to jump onto this meeting to educate myself about, the services available in the community now, specifically through Human Services, because, things change. And so I am happy to share a little bit of information about what is available at the hospital. And of course, there are other resources out there in the community as well. So here at the hospital at Door County Medical Center, we do have a behavioral health program. We have 3 service lines through our behavioral health program in the clinic. We have 5 licensed clinical social workers, and then we have a psychiatric mental health nurse practitioner who is able to provide behavioral health services. We, about a year ago, so in October of 2020, which was right in the middle of COVID, we opened up a new program called Senior Life Solutions. And it is an intensive outpatient group therapy program for seniors, typically age 65 and over. And we provide individual and group therapy sessions We have a psychiatrist who sees our patients monthly and as needed. We have a registered nurse who helps coordinate care with our patients' primary care providers and the psychiatrist. And we provide transportation and meals for clients when they come to our program. Because of COVID, we also provide our group therapy, or all of our services actually, via telehealth and in person. So patients have the option to participate from their home on Zoom, which has been certainly a great thing to be able to offer given COVID and people's limited ability to leave their home. So we've been up and running, like I said, for about 1.5 years or so. It's been really a great privilege for me. I've been at the hospital here for 6 years, and it's been nice to be able to offer this service specifically to our senior population. I've been working with Corey and Brianna on putting out some information for Mental Health Awareness Month next month, that we learned last year, a sad statistic, that 7 people in our county last year died by suicide, and 6 of those 7 people were age 60 or over. You know, our senior population has unique needs and often experience those struggles alone for a number of reasons. And so this program is designed to meet the unique needs of seniors here in Door County.
Lauren, thanks a lot for jumping in and
Thank you.
sharing what you guys are doing. It sounds like an awesome program, and certainly is a benefit and a need for us here in Door County. So one of the other questions in the chat is related to sober living facility. And just to give folks a little bit of information about that, we currently have been working with the county board at looking at development of a sober living facility here in Door County, partially tied to our drug court program, but certainly tied to our AODA services. AODA is an interesting need in our community. And just talking about history, I've been here for 29 years and started out as an AODA counselor in Door County. And so I will tell you that we've had a changing landscape over time. And right now we're in a pretty tough spot. If you're watching any of the Green Bay news, you're hearing about fentanyl and other opiate products and methamphetamine in the Green Bay area, which is very strong and heavily coming in. And that is happening here in Door County as well. So I think sober living for us is going to be a key need over the next several years that we're going to have to figure out. So currently where we're at in that process is I have been looking for a home. The county has designated some of our ARPA funding through the federal government to use for that purchase of a home. So our first step is actually finding a place that kind of meets the bill, and we're looking for a place that could house both males and females, and that may either be 1 or 2 facilities depending on what we find. And then from there, we'll provide some programming, and those people will also be connected to our intensive outpatient program. In Door County, there are not other AODA providers for the general public. Dynamic Family Solutions provides services for probation and parole clients. I'm not aware that they're providing services for other individuals at this time. And I don't believe the hospital has some staff that are certified to do AODA, but they don't do AODA programming specifically. And if I'm wrong about that, Lauren, you certainly can jump in and answer that. Let's see, a question just came in. I'm going to read here. Let's see, does sober living home have to be a purchase, or could it be a long-term lease? That would seem to open more options. That's a great question. I don't think it has to be a purchase, but the funding that we have available would have to be used within the next 2 years. So in some ways, that is our best option, the purchase of a home. So, and then there was another question in our chat. And again, for people who are watching maybe on a taped version, I'm not sure that you can read the chat. I don't know how that works. But one of the questions was how many people have been served through the Senior Life Solutions? And Lauren answered that 25 people so far. So at this point, I do not see any other questions. If anybody has any, we'll pause for a second to see if you want to send some in. And if not, I'm going to throw it back to Susie and go from there.
Okay, I guess we've finished the questions. Sandy, did you see any on Facebook?
Nope.
I guess. Okay, thank you. Well, thank you all. Joe Krebsbach, Donna Altapeter, Jamie Cole, Cheryl Flores, and thank you, Lauren, for being willing to jump in without having had a minute to prepare. But we really appreciate all the information you shared with us. And we hope people will tell friends and neighbors so that they can also learn about it. Thanks to Laura Kayakan and the library for partnering with us. This program was recorded, as she explained earlier. It'll be available also, in addition to the library sources, it will be available on the League website as soon as we can get it up there. And I believe League's Facebook pages. Anyone interested in the League mental health and substance use study will find it on the League website, along with 2 videos presenting the Door County Treatment Court and a video explaining STRIDE, which is the mental health program in the Door County schools. You can also learn more about the Door County League and how to join us by checking the website, which is www.lwvdoorcounty.org, and on Facebook. We really appreciate you joining us today and the presenters for sharing their time and expertise. And I think that's it. We're finished. Have a good
Thank you. Happy
afternoon.
Easter, everyone.